Thank you, Maggie. Good morning. Jim and I are really excited to be here today to talk with you about experience design. So experiences. The experiences that we create and deliver, intentionally or not, they really define us. In fact, these experiences, am I on? Can you hear me? Testing?
Better.
So these experiences that define us, they can also make or break an organization. You know, the experiences that we all have, especially healthcare experiences, they're really all across the board, aren't they? I mean, some of them are good, but some of them are terrible. Some are painful, some are humiliating, some are downright degrading. But you know, it doesn't have to be that way, right? I mean, if you think about it, why can't these experiences be healing experiences? Or why can't they instead be positively transformational? Now, we know that that's a tall order. It's an elusive nut to crack, this idea of providing great experiences, especially for healthcare, because healthcare is so complex. Think about your own healthcare experiences. The last time you went to visit your doctor or had some kind of medical procedure. How many of you walked away saying, wow, that was one fabulous transformational experience?
No.
Not too many hands going up, we see, okay? But really, it doesn't have to be that way. We're here to talk today about a conceptual framework, right? And it's a way to design better, more intentional, more integrated, more holistic experiences, because that's what so many organizations seem to miss these days. And you know, that's what so many people, especially patients, want and need. This conceptual framework is what we call total experience design. So what is it? Well, successful total experiences really have 4 elements. First, there's the perception. Every organization has a perception in the marketplace, right? Its brand, its image. And then every organization makes a product or delivers a service, and there are the people of the organization who make the product and deliver the service. And finally, there's a place. Even if it's virtual, there's a place where all of this work gets done. And successful total experiences are all about intentionally designing in all of these 4 areas in an integrated way. Because if only one of those elements falls short, the entire experience can fall short. So let me share with you an example that I'm sure you've all had. Going to a new restaurant, going to dinner at a new restaurant in town. So let's say you see an ad for a new restaurant and you read the review and it's great. So you make a reservation and you show up on a Friday night and the place looks exactly like you imagined. It matches your perception. It looks like that little Italian bistro that you visited last fall when you were in Tuscany. And then the waiter comes to the table and he is the real deal. You find out that he grew up in Tuscany, right? And better yet, he knows the menu and the very impressive wine list like the back of his Italian hand. So he helps you to order, goes away to the kitchen, and then later the food comes and it looks like this. Yeah, and it tastes even worse,
Yep.
Okay? Would you go back? Probably not. All of the other elements were great, but one element, the food, brought down the entire experience. So think about it. What if all the elements were great, but that waiter, what if he were rude to you and dumped wine in your lap? Or what if all of the elements were great, but that place was actually dirty? Or worse yet, what if you never saw the ad for the restaurant? Or what if you read the review and it was awful? You probably wouldn't have even gone at all, right? So it doesn't matter the industry or the organization. Successful total experiences need to be designed in an integrated, intentional manner. You know, if you have a lousy experience in a restaurant, the worst that you can probably get is indigestion.
And in healthcare, if you don't get these right, people can die. Receiving healthcare in America is the 3rd leading cause of death in America. Healthcare is ever more complex than a restaurant. So where do you begin? How do you go about creating intentional, life-enhancing, and transformative experiences? You start with your vision. And anybody can do this. You can do this. And here's a story of a client of ours who has done that. San Juan Regional Medical Center in Farmington, New Mexico, who amongst others serve the Navajo Nation. And they get it. I mean, these guys really get it. And this is their vision. I mean, how many vision statements have the words enthusiasm and vitality and healing in them? And like we've been talking about over the last day and a half, San Juan really understands the importance of, if you are going to provide exceptional patient experiences, you need to first start with providing exceptional, personalized staff experiences for those healing professionals. And so with this vision in hand and a need for a large building project, which they used as a catalyst for overall organizational transformation, they changed everything about their experiences, the way they were perceived in the marketplace, the way they treat their staff, the way those staff as healing professionals treat and serve the patients that they care for every day, all in a new place. And they got started by this understanding that a vision is great, but everyone needs to own the vision and everyone needs to live the vision. And so they pulled everybody together, staff, patients, family, board members, physicians, nurses, community leaders, to all work together to create a tangible vision for what life would be like in the future. And they did this by participating in, well, visioning sessions.
So to begin to design successful total experiences, you really need to start at the end with the people for whom the experiences are intended. So for San Juan Regional Medical Center, that was, the patients and the staff. And so they began by looking at all of their target markets, their primary target markets, and they identified biographies, actually started to create biographies of patients who represented their target markets, looking at demographics and psychographics, likes and dislikes, medical condition, and they made these folks real. And they did this in small groups. They really busted silos, right? They came together in small groups, doctors, nurses, facilities engineers, marketing staff, board members, HR professionals. And working in small groups, they really fleshed out these stories. They made these folks real. And here's an example of a Navajo patient. Again, because they serve the Navajo population as part of their primary census. So they created these biographies, and then they were asked to create an ideal day in the life of these folks, okay? Ideal, not a better day in the life, but an ideal day in the life. And the scenario that they were faced with was this. They were told that it was 2020, and that San Juan Regional Medical Center, they had made manifest their vision. They did it, and they were living their vision in every single way. And then they were asked, okay, now, imagine an ideal day in the life of this patient. What would that be like, look like, feel like, smell like, sound like for this particular patient? And they began to develop stories. And out of these stories came experience themes and strategies. So for instance, in this patient, with a nod toward his cultural traditions, they thought, well, the family would be involved in the caregiving, and maybe even this patient's tribal medicine man. And that would necessitate larger than typical patient rooms with the right accommodations and access to the outdoors. Similarly, they started looking at the staff experience, right? And because the staff is Navajo, that made a difference. And they began to develop ideas and drivers that came out of ideal staff experience stories as well.
And so with these ideal experience stories in hand, and their vision as a guide, and the framework of total experience design, San Juan transformed all of the experiences throughout their organization. In terms of perception, knowing that the Navajo were a key cohort that they served, and that they wanted to show that they reflect, or that they would respect the culture and the traditions of the Navajo, here you can see the new main entry, which faces east, which is the tradition in the Navajo homes. so that the entry faces the new day's rising sun. And from the entry, you walk into this welcoming lobby where you can see beautiful artwork, the warmth of a fire, natural materials. And even though you're inside the building, you can see out to the beautiful surrounding views of the mesas beyond. And if you were to walk through these doors, you would go to this healing garden. And one of the things that was learned from the Ideal Experience stories was that everybody, not just the Navajo, everybody who really lives in this part of the country lives here to be outdoors. They love the outdoors. So this was a place for everybody, for rest, relaxation, and rejuvenation. And all patients are cared for in private rooms. And it's important for the Navajo to die outdoors so that death spirits can be released and not endanger the living. And sadly, before these transformed experiences, it wasn't unusual in the hospital for patients to die alone, for family and staff's fear of being in a place where sometimes death occurred. And so each patient room is provided with its own dedicated, screened-in porch where patients can go, family members can go, where death spirits can be released, and where everybody can feel safe and comfortable being in a healing environment. And the porches also afford additional space for all families to be a part of that caregiving experience. And instead of traditional chapels or chapel in the hospital, there are meditation rooms on every floor. And while round, symbolic of and reflective of the round hogan, which is the Native American Navajo home, it's a soothing and comforting place for everybody. And in here, the experiences have included musical performances, weddings, memorials, and even medicine men ceremonies. This is a section drawing through the bed tower of the new hospital. We've talked a lot about what we're calling ideal patient and family spaces, and these are on-stage spaces. These are the ones for your customers, your patients, the people that you serve. But in order to do that, remember that vision statement that talked about creating ideal personal experiences for the staff as well. A key planning concept was to create offstage spaces for all of the staff. And this is a concept that was borrowed from Disney. Where in Disney World, they have a whole subterranean level below Disney World, where frankly, the performers don't need to be on stage until they're on stage. And so at the start of each day, the staff can come to a new entry that's dedicated just for them. And as they come through, like Sharon, there's a employee wellness and fitness center that's just for the staff, celebrating and recognizing the commitment of San Juan to their staff and their health. And during the Ideal Experience Stories for staff, they identified that they are compassionate. They are dealing with emotional issues as they care for the patients and their families. And they wanted a place where they could go and decompress and renew and refresh themselves. And so there are on each floor a dedicated staff-only screened-in porch as well. And it's in close proximity to the patients and families should they need to be in a caregiving on-stage experience. You know, and the staff in these Ideal Experience Stories had asked for their own private staff cafeteria. I mean, really, who listens to their staff and gives them what they want? Well, San Juan did. They gave their staff their own private cafeteria. It's a place where they can have their own conversations. They don't have to worry about HIPAA infractions. They can let their hair down, or actually they can keep those funny hair nets on that they wear during lunch. And the advantage of that is that the patients and families and visitors who have their own dining experience don't have to be sitting next to people in their surgical attire while they're eating. And this is the outdoor terrace, again, that place for everybody, just being a part of the beautiful surroundings of New Mexico and the mesas. And of course, the Healing Garden is a place that's welcoming for everybody, families and children included.
So why should you care? Why should you care about this independent community hospital in New Mexico's journey? Well, you should care because their journey produced some really transformational results.
Remember at the beginning how I told you healthcare is a dangerous place? San Juan has reduced their mortality by 39%. That's pretty transformative for those patients. And any business would love to have these kind of stats, healthcare or anywhere. Staff turnover has been reduced by 23%, and overall staff physician satisfaction is up 10%.
So the Disney Institute got wind of what was going on at San Juan, and they decided to come for a tour. And this is what Chris Karachi of the Disney Institute said after touring San Juan Regional Medical Center. And you know, Disney, they've set the standard, the gold standard for designing exceptional on-stage and off-stage spaces for their employees and their guests. So this is pretty impressive. So we've told you why you should care. Now we'll ask you, what can you do? What can you do to start your own transformational journey? Well, we'd suggest you start with your authentic organizational vision, and then begin designing experience to match and make manifest that vision in everything you do day in and day out. So we'd like to leave you with one more question for you to consider, and that's this. What experiences will define you? Thank you.
Thank you.